Some older adults are living with a quiet, uncomfortable truth. There are medications you take every day that feel completely normal, common, familiar, even routine in many clinics. But over time, they can quietly strain the heart. Not in a dramatic way. Not like you take one pill and something happens right away. More like this: you feel a little more tired than before. Your breathing feels shorter on simple tasks. Your heartbeat sometimes feels irregular. Your blood pressure becomes harder to stabilize. And you tell yourself, it's just age. But sometimes, it isn't only age. Here is what makes this scary. Many of these drugs are prescribed correctly. They work for the problem they're meant to treat. The issue is, your body after 60 plays by different rules. Your blood vessels are less flexible. Your heart has less margin for stress. Your liver and kidneys may clear medicine more slowly. So a small effect repeated every day can build up, month after month, year after year. In this video, I'll walk you through 7 common drug groups that may raise cardiovascular risk in older adults. And more importantly, I'll show you how to talk to your doctor about safer options without stopping anything on your own. Because the goal is not fear. The goal is protection. And in the next part, you'll understand why the exact same pill can feel harmless to a younger person, but quietly hit the heart much harder in someone over 60. After 50, your body isn't breaking. It's simply changing the rules. And this is where many people misunderstand what's happening. They notice higher morning blood pressure, a faster heartbeat after just a few steps, shorter breath on the stairs, and they think, my heart is weak now. But the deeper truth is this: after 60, your heart and blood vessels become more sensitive to everything that enters your system. Your arteries are less elastic, so even a small trigger can cause a stronger tightening response. Your kidneys may filter more slowly, so medicine can stay in your bloodstream longer than it used to. Your liver may process drugs more slowly, so the same dose you tolerated years ago can now be too much. And here's the most dangerous part: many medications don't hurt you in an obvious way. They don't create sharp pain. They don't give you a clear warning. They simply make your heart work harder, a little more, every single day. It's like asking an older person to carry a small extra bag of rice daily. The first day feels fine, but after months, the strain shows up. And after a year, the body can't hide it anymore. If you take multiple medications, this becomes even more important, because drug effects can stack and quietly push blood pressure up, disturb rhythm, or cause fluid retention that exhausts the heart. Please watch this video all the way through, because if you recognize even one drug group that may be stressing your heart, you may prevent a very serious risk. And next, I'll give you a simple framework, 3 questions you can use to check any medication without panic and without guessing. To follow the next part without fear, I want you to hold one simple framework in your mind, just 3 questions. Every time you hear the name of a medication, ask yourself, first, how does this drug affect the cardiovascular system? Does it tighten blood vessels or relax them? Does it speed the heartbeat up or slow it down? Does it cause the body to hold onto salt and water? If you understand the direction of the effect, you're already halfway there. Second, who is most vulnerable to it? People over 60, people with high blood pressure, heart failure, or atrial fibrillation, people with kidney or liver issues, people taking multiple medications at the same time, because the same pill in a different body can create a completely different risk. Third, what are my warning signals? After taking it, do you feel more palpitations, more swelling in the ankles or feet? Do you get tired faster than usual? Do you feel dizzy when standing? Do you wake at night with heavier breathing? This is not for self-diagnosis. It's so you can notice patterns, write them down, and speak to your doctor with clarity and confidence. And now, before I list the 7 drug groups, I need you to hear one safety rule that can protect you immediately. Because many people reach this point, panic, and do the wrong thing. And that mistake can be dangerous. In the next part, I'll give you that safety rule so you stay in control while protecting your heart. This safety rule is something you must hear clearly. Do not stop your medication suddenly, just because you hear its name in this video. Even if you feel worried, Because with certain drugs, stopping abruptly can trigger a rebound response. Blood pressure can surge. Heart rhythm can become unstable. Stomach acid can flare back aggressively. Sleep can collapse again. And sometimes, the sudden stopping is what hits the heart the hardest. The right move is not panic. The right move is identify, write it down, and change with guidance and control. Here are 3 simple steps. 1. Write the medication name, the dose, and how long you've been taking it. 2. Write down 2 or 3 symptoms you suspect may be connected, especially anything related to blood pressure, pulse, breathing, swelling, or fatigue. 3. Prepare 3 questions for your doctor. Is there a safer option for my heart? Should my dose be reduced? What warning signs mean I need urgent care? That's it. With those 3 steps, you become much safer immediately. And now, we start the list. The first drug group is one that millions of older adults take every day for reflux, bloating, or stomach discomfort, often for years. Without realizing it, may have long-term effects on the cardiovascular system. In the next part, begin with that group. Drug group number 7 on today's list is a stomach medicine many people think is harmless. It's the PPI group, proton pump inhibitors. A lot of older adults take them for reflux, burning, sour taste, bloating, or vague stomach pain. The problem is not that PPIs are always bad. The problem is this: many people take them every single day, for years, almost like a habit. And with long-term use, the body can shift in ways that may not be friendly to the heart and blood vessels. Some evidence suggests long-term use may be associated with less flexible blood vessels and a stronger tightening response in people who are sensitive. Now, don't panic. Go back to the 3-question framework. Ask yourself, how long have I been taking this? Do I truly need it every day? What habits are keeping me dependent on it? Here is a very real-life pattern: late dinner, then lying down quickly, and waking with chest burning, coffee on an empty stomach, spicy and acidic foods, and the PPI becomes your daily armor. But sometimes, just 3 changes can reduce the need. Eat dinner earlier. Elevate the head of the bed. Cut back on spicy, acidic foods and avoid coffee when the stomach is empty. Then ask your doctor if you can step down gradually, or switch to a lighter option when appropriate. If you take a stomach reflux pill every day, common one, and it'll give you 3 smart, respectful questions to ask your doctor so you protect your stomach without sacrificing your heart. And next comes a group that truly surprises people: a common antibiotic class that can affect heart rhythm and even major blood vessels in older adults. Drug group number 6 is an antibiotic class that many people have taken at least once in their life. And because it can feel strong, fast, and convenient, it sometimes gets prescribed a little too casually. It's the fluoroquinolone group, such as ciprofloxacin, levofloxacin, and moxifloxacin. Here is the key point. In older adults, especially anyone with a history of heart disease, high blood pressure, rhythm problems, or anyone taking multiple medications, this group can raise risk in 2 important ways. First, it can affect the heart's electrical system. It may prolong the QT interval, something that sounds technical, but it can be connected to dangerous rhythm disturbances in vulnerable people. Second, there have been warnings and concerns related to major blood vessels, particularly in people who already have weak vessel walls or risk of aneurysm. You don't need to memorize the medical terms. Just remember this sentence: if I'm over 60 and I am prescribed a strong antibiotic, I have the right to ask, is there a safer option for my heart? Because many mild infections can be treated with other choices that may be more appropriate. And please don't reuse an old prescription on your own. The same symptom today does not mean the same body as last year. If you've ever taken an antibiotic and then noticed palpitations, fast heartbeats, or dizziness, write it down. And next, we move to a group almost every home has in a drawer: pain and inflammation pills. And this is where many hearts quietly get pushed too hard without anyone realizing why. Drug group number 5 is pain and inflammation pills, the kind many people treat like, if it hurts, just take one. Ibuprofen, naproxen, diclofenac, and other common joint pain medicines that are widely available. The danger with this group is that it can load the heart in several ways at the same time. First, it can raise blood pressure, especially in people who already struggle with hypertension. Second, it can cause the body to hold onto salt and water. And when the body holds water, the heart has to pump more. Breathing can feel heavier. Ankles can swell. Fatigue can climb. Third, in some people, especially with higher doses or repeated use, it may increase the risk of cardiovascular events. Here's the real-life mistake many older adults fall into. Knee pain. Take it for a few days. Feel a little better. Then pain returns, so you take it again. And suddenly, every month has a couple weeks of these pills. What you don't see is the quiet cost. The heart is paying for that relief. If you need pain control, remember this. It doesn't always have to be long-term oral medication. You can ask your doctor about topical anti-inflammatory gels, physical therapy, gentle strengthening, heat or cold therapy, or a safer plan that fits your heart situation. And one more thing. If you take heart medication or blood pressure medication, be even more cautious, because interactions can quietly push things in the wrong direction. And next, well, move to an older class of diabetes drugs, used for years by many people, without realizing that in some cases, they can stress the heart in a different way. Drug group number 4 is an older class of diabetes medicine that many people have taken for years because it's familiar, because it's affordable, because it brings the sugar down. This is the sulfonylurea group, such as glimepiride, glyclazide, and glyburide. The issue is not that everyone who takes it will have trouble, but in older adults, there's one dangerous trap: low blood sugar. When blood sugar drops, the body switches on an alarm system. Adrenaline rises, the heart beats faster, blood vessels tighten, blood pressure can swing, and if that happens repeatedly, the heart gets stressed in a very exhausting way, pulled back and forth, fast, then slower, tense, then unstable. And there's another real-life factor. Many older adults don't eat on a perfect schedule. Sometimes a meal is skipped, sometimes dinner is late, sometimes appetite is low. And that's when these medicines can push sugar too low without you expecting it. A very common warning pattern looks like this. You feel fine. Then suddenly you shake, you sweat, you feel your heart racing. You get intensely hungry or lightheaded. If you felt that, write it down, what time it happened and what you took that day. The big takeaway is this. Today, there are diabetes treatment options that can be more heart-friendly in many situations. You don't change anything on your own, but you can ask your doctor one powerful question. Is this medicine the best fit for my age and my heart? And next, we move to the medicine many people become most dependent on: sleep pills. They may not sound connected to the heart, but they can pull the heart into trouble in a very indirect way. Drug group number 3 is sleep medication. Many older adults struggle with insomnia for years, and then they're prescribed medicines like zolpidem, ezapicolone, or benzodiazepines, such as lorazepam or diazepam. You hear sleep pills and you think, what does that have to do with my heart? But this is an indirect trap. Sleep medicine can make you sleep deeper, but it can also make breathing more shallow. And in someone who has sleep apnea without realizing it, that can lower oxygen levels during the night. When oxygen drops, the heart has to work harder. And there's another risk. These drugs can make you groggy, slow your reflexes, and affect balance. So when you get up to use the bathroom at night, you're more likely to fall. And for an older adult, one fall can lead to hospitalization, stress, infection. And the heart can decline very quickly after that chain begins. The key message is not never use them. The key message is don't become dependent, and don't stay on them long term without reassessing. Ask your doctor about non-drug sleep strategies, or a safe, gradual taper plan if you've been using them regularly. And next, we come to a medication group that requires extreme caution in older adults, especially those with dementia, because there is a serious warning that every family should know. Drug group number 2 is antipsychotic medication. These are sometimes used when an older adult becomes agitated, restless, paranoid, or when dementia leads to behaviors that feel hard to control. Names may include quetiapine, risperidone, olanzapine, and others. I'm going to be direct. This is an extremely sensitive category for older adults because it can affect heart rhythm, blood pressure, and metabolism. In some cases, it can prolong the QT interval, meaning the heart may become more vulnerable to dangerous rhythm problems, especially in someone with a fragile cardiovascular system. It can also cause orthostatic hypotension. You stand up, you get dizzy, you fall. And just like we discussed with sleep pills, a fall, a hospital stay, stress, infection can push an older heart downhill very fast. There's more. This group can contribute to weight gain, higher blood sugar, and abnormal cholesterol, quietly accelerating the pathway toward vascular disease. And the most important point, in older adults with dementia, these medications carry a serious warning about increased risk of death. So, if someone in your family is taking them, this is not about panic. It's about careful review with the doctor, lowest effective dose, shortest necessary time, and close monitoring. If this is helpful to you, please like this video. Because next comes the #1 drug group, prescription painkillers, where one wrong combination can put the heart and breathing in real danger during the night. Drug group #1 is prescription opioid pain medication. Oxycodone, hydrocodone, morphine, fentanyl, tramadol. Many people take these for severe back pain, intense joint pain, post-surgery pain, or long-term chronic pain. And this is the most dangerous group, not only because of dependence, but because it can directly affect breathing and the nervous system. And that can pull the heart into serious risk. Opioids can slow breathing and make breaths shallower, especially at night. When oxygen levels drop, the heart has to strain to compensate. They can also make you groggy, increase fall risk, increase confusion about dosing, and increase the chance of stacking medications by mistake. And there is one combination that can be especially dangerous in older adults: opioids plus sleep medication, or opioids plus sedatives. Together, they can suppress breathing far more than either one alone. This is one reason some people go to sleep and don't wake up normally. So, if you or a loved one uses an opioid painkiller, please treat this as a serious signal to review the plan with a doctor. And next, it'll give you a simple 5-minute checklist, so you can walk into an appointment, speak clearly, avoid being dismissed, and make a safer decision for the heart. Now comes the most important part: turning information into action. Here is a simple 5-minute checklist. Do this before you see your doctor or before you call your pharmacist. Step 1. Gather every medication you take, not only prescriptions, also stomach pills, sleep pills, pain relievers, vitamins, and supplements. Put them on the table so you can see the full picture. Step 2. Write 3 lines for each one. Name of the drug, the dose, and how long you've been taking it. That's all. Step 3. Write down 3 recent body signals. For example, palpitations, heavier breathing, ankle swelling, dizziness. When standing, getting tired faster than usual. And here's the key: write the timing: morning, night, after taking a pill. Step 4. Bring these 3 golden questions. What is the goal of this medication, and do I still need it every day? Is there a safer option for my heart at my age? If we change it, how should we taper safely to avoid rebound effects? If you ask these 3 questions, the conversation changes completely. You're no longer someone who just listens and leaves. You become the person protecting your own heart. And next, I'll close with one gentle but powerful philosophy so you don't fear medications. But you also never blindly trust them again. Medication is not your enemy, but medication is not a magic shield either. It's a tool. And after 50, 60, 70, every tool must match the right person, the right dose, and the right moment. What makes your heart safer is not taking more. It's understanding more. Understanding what a drug is doing inside your body. Understanding which signals are normal and which signals are warnings. And understanding this, you have the right to ask questions. You have the right to say, "Doctor, is this medication the best fit for my heart and my age?" You have the right to request a safe plan to adjust or switch slowly, carefully, without risky sudden stopping. If you've listened this far, I want you to do one small thing. Comment 1. If you want me to write a short, respectful script you can bring into the clinic. Simple, clear, polite, but strong enough that the doctor has to answer the right points. And if this video helped you feel calmer and helped you understand your medications more clearly, please subscribe, because in the next video, it'll show you safer alternatives for each group so you can manage pain, sleep better, calm reflux, and still protect your heart.